you can see from the program is, what is it? What is the theme, please? Yes? Before anxiety, I had a few. What was the theme? Manage anxiety before it manages, right? So today we are going to have a very good 2 sessions on management of anxiety and also on psychological first aid. Psychological first aid is something like the physical first aid that we all know about, right? So this has to do with the mental and the psychological aspect. So fortunately, we have 2 great experienced experts in the field of mental health to be our resource person. So first of all, I would like to welcome the VC, the Vice Chancellor, Professor Rath. He has been a great support for all the activities in the university. Academia, academics apart. That is obviously the priority. But besides that, to be a whole person, to be a mentally healthy person, we have to look at the other aspects around us, right? And specifically when we talk about mental health, we all know that whichever religion we belong to or we believe in, physical health, mental health and spiritual health is necessary, is a must for all-round development of people, right? So today we are going to have that session. So welcome Professor Rath. He is the guest of honor for our session today. As I said, he has been always supportive of all the activities, all the workshops, trainings, etc., that has been taking place in the university for the last 20 years or so. So first of all, I would like to introduce the first resource person and then also the members of the Mizoram University Counselling Cell. Okay? So all of you, please see who they are, which department they are from, so that you will be able to get help from them. We have online as well as face-to-face counseling facilities. Okay? After my introduction, I will give you a brief background into Mizoram University Counselling Cell, how it was established, etc., etc. I will not take very long, so please bear with me. To my right is Dr. Let's make it self-introduction.
My name is Lalropuii. I'm Assistant Professor in the Department of Sociology.
Hello, good morning all of you. My name is Dr. Lalropuii, Assistant Professor of the Department of Clinical Psychology, and a member of Mizoram Counselling Cell.
Good morning everyone, my name is Dr. Zoengpari from the Department of Social Work. Good morning, my name is Dr.
Good morning, everyone. My name is Zoengpari, Department of Education, member of the MZUCC.
Hello everyone, my name is Lalropuii from the Department of Clinical Psychology. Good morning everyone, I'm Zoengpari, Assistant Professor from the Department of Clinical Psychology.
Good morning everyone. My name is Lalropuii. I'm a professor in the Department of History and Geography and the current Dean of Students Welfare.
Thank you. So at the back we have Dr. Sabiha Alam Chowdhury, Assistant Professor, Department of Psychology. She is also a member of the Mizoram University Counselling Cell. Thank you. Okay. I will just give you a brief overview of what and who Mizoram University Counselling Cell is, right? So the Mizoram University Counselling Cell was set up in 2011 under the aegis of the Professor Jay Singh from the Social Work Department. He has since passed. Then in 2020, it was reconstituted as Mizoram University Counselling Cell. And the Mizoram University Counselling Cell is located at the Department of Psychology, School of Social Sciences. We have a counseling room there on the ground floor next to the history department. And whoever is the HOD of Department of Psychology automatically becomes the ex officio convener of the counseling cell. So the purpose of setting up the Mizoram University Counselling Cell is that all the university fraternity, teaching, faculty, staff, students, whoever is in the fraternity will have some services with regards to counseling. When we talk about counseling later on, it will be given to you, the information will be given to you in detail. Let me just say that the counseling center is opened. We have a list of 11 counselors who have given their phone numbers and their times. That information will be posted in all the departments. Say for example, my time is I think on Monday in the afternoon, 3 to 6 o'clock. And my phone number is there. So any student, any faculty, any staff who wants counseling, and my number is there. So if they want counseling on a Monday, say for example, when I'm available, or if they want, say for example, Dr. Zara specifically for the counseling, his name and his phone number is in the list. Okay? So it's up to the students, it's up to the fraternity to decide who they want to get the counseling services from. So that's how we are going to, we have been actually functioning, and we have had a couple of, especially during the COVID times, we did a lot of online counseling. But since last year, since last part of last year, we are trying to revamp, REVAMP, the counseling, Mizoram University Counselling Cell. So we have been doing counseling here and there, but not so much on a regular basis. But in the next couple of weeks, now that we have identified departmental coordinators are faculty from each of the 39 departments of the university. We also have 13 hostel prefects who have been identified. The university authority have given the notification to each of the departmental coordinators, one faculty from each of the departments, and to all the hostel prefects, one hostel prefect from each of the 13 hostels of the MZU. So the departmental as well as the university coordinators consists of the 39 faculty plus the 13 hostel prefects of the university. So the role of the departmental coordinators is to identify or the students who are in need of counseling will meet or will get in touch with the departmental coordinators or the hostel prefects, and they will refer to the counseling. Or if that is too long a process, the student or the fraternity member who wants to have counseling services can straight away call up the counselor based on the roster which will be presented. Am I clear? So people have an idea. Today we have invited the departmental coordinators from the 39 departments and also the 13 hostel prefects. So many of them have other programs and could not be here, but I think there's a good number of us. So whatever, we have the departmental coordinators WhatsApp group also. So if there's any clarifications, anything that we need, we could always address our queries to the WhatsApp group. And also, the departmental coordinators had been requested by the registrar to nominate 2 students from each department. So head count, as we had counted according to the notification, is about 120 people. We are a little bit less than that, but that's quite all right. Because those people who were not able to come because of other busy schedules will have missed a great opportunity to have an overview, to have a lesson on mental health and mental health issues and challenges. So now I would like to invite Dr. Lalropuii, one of the Mizoram University Counselling Cell members, to felicitate the chief guest. Thank you, sir. So now I would like to invite the chief guest to give a inaugural address.
Thank you very much, Professor Zoengpari. I'm sorry if I'm having some wrong pronunciation. We are good friends and colleagues for a long time. And Dean Student Welfare, different coordinators of counseling, MJDU Counseling Cell, our expert Dr. Pui, who is specialized in mental counseling. So I didn't know about this. There is a counseling cell. There are many cells and centers in the university which we are not very much acquainted. But whenever I took charge in November, I came to know there are many centers and cells. Well, schools and departments are there, but I was not that much of aware. Very few centers we know, but cells I had no idea. When Professor Pari brought to my notice that there are many cells, it will be more than 20 cells, except centers and departments and schools. So they were almost all inactive. They did not have any function, nothing to do, just namesake. So when she brought to my notice, we'll say, we'll do something we'll do to make all cells activate and how to function it well for the purpose they have been established. So that was the intention, and the opportunity came in different meetings, and she was constantly in touch with Center for Women Studies. She is holding director there, and counseling, many other frequent interaction. So we took a decision that we should give them some funds so that the center is properly activated and the actual benefit goes to the students. I know the students, whether it is they are undergraduate or postgraduate students, in course of their study, they come across a number of, incidents where it lead to mental illness, then what do you say, depression and mental shock. And some students, not, it's very common, not here. And some students also follow or adopt some sort of, what I say, unexpected consequences, even to the extreme committing suicide. If there is a slight little failure in the exam, it shocks them, mental shockness. And these types of things are very common. And how to avoid these mental stress, excitement, and depression, I'm sure the counseling cell of our Mizoram University have been doing lot of activities in the past, and I can only say that expect and request that they will do more in the coming days. Now today there is a good response, and there are experts who will be speaking on what are the exercises and activities that you can do at home so that you are mentally fit. It's not that you are physically fit. Equally important is mentally fit. Sometimes I feel the mental fitness is more important than physical fitness. If my brain is functioning well, my brain is a very constructive and a productive brain, output depends upon that. Outcome and output depends upon that. If I am mentally ill, I have some mental illness, I have some depression, I have some mental stress. So in many management institutions, even normal also, academic department, they particularly, there is a specialized study of stress management, conflict management, many management techniques. So this is one of them, how to have a sound mind and brain and memory, so that it reflects on your academic and educational activities and your career prospect. So what is very important is the mental fitness, most important than the physical fitness. Well, diseases are very natural and uncalled for. we can't have any prediction that I am going to have such type of disease or this thing. But certain things which are in our control, if I am getting some mental problems, you can go to counseling center, which are very common in European and advanced countries. This counseling center is very popular. It is even a small problem, and people advise better you should follow counseling center and go for counseling. So it is in this context, this cell assumes a great importance, very significant, and I am sure, and I request the counseling cell director or coordinator to do lot of activities which is visible once in a month, once in 2 months, and the students, those who are representing, I am told 2 students from each department. I am sure when we go back to the department, you act as like a training to the trainers. You train your friends. If in a batch there are 40 students, only 2 students have come to this particular program. So what about the 38 students? Please go back, and also whatever you learn here, you reciprocate the same thing and your batchmates. And if you can have at least 1 hour, 2 hour session in your department, it will definitely serve the purpose for which today such an important activity and exercise is taking place, and it has a great impact on your not only mental health and fitness, and also for your future career prospects. With these words, I once again thank the organizers, and particularly the professor and head of psychology and in charge counseling center for organizing such a very wonderful and very productive program where the real benefit goes to the students. Our target is our students and scholars. If the students and scholars are safe, sound, mentally sound, then everything is well. So with these words, once again, I thank for participating particularly this program, and I thank this counseling cell for organizing this program. Thank you so much.
Thank you so much, Professor Rath. As I said earlier, he's always been a very big supporter of the overall development of people of the university fraternity in terms of the different cells, centers, etc., etc. Thank you for your blessings, sir. So with that, we come to the end of the inaugural function, because we have the very big 2 more sessions that are coming up. I would request all the members of the Mizoram Counselling Cell to bid the Vice Chancellor by, and if he is interested, he could also participate, sir, for the first session. Yeah. Okay. Okay, thank you very much, sir, for your support. Yeah.
Good morning, everyone. We'll start the first session of the day. We have with us Dr. Lalropuii, a renowned speaker, a popular speaker and counselor. And she was my class teacher in St. Paul's High School, 1992, Class 8, Section A. So it was that long. So let me call her. Yes, yes. We've been calling each other like this, then she will call me out, I will call her out like that. So today it's my turn to invite her to speak. So let me call Dr. Lalropuii to deliver her speech.
Thank you. It is a privilege for me to, have a talk, and then when the important persons are my ex-students. So I feel privileged to be a teacher at St. Paul's High School, and I feel so proud of my students, the past and the present. And today I feel honored to come here, and Dr. Maya has asked me to talk about anxiety and self-management. And she had asked me, and Ms. Afakis also asked me whether I'm going to present in the PPT form. And I love to present something in an academic settings, but when it comes to workshops and trainings, I am not in favor of PPT, okay? Because self-management, self-care, mental health, when we are coming into the forefront, I think we need to experience more than gaining knowledge. What do you say? Yes or no? So I am going to speak for about 20 minutes because I think we need to have some interaction. That's what the organizers wanted me to do. So today I am going to talk about a little bit of anxiety. Okay, we'll just wait for certain people to come in. In the meantime, I want you to write down your questions while I give my speech. Okay, so that we will be having an interaction time from 12 to 12:30. By that time, it will be much easier for you to ask me questions. So we won't waste time. Time is precious. Yeah. So, and then I have a lot of, I'm sweating a lot. Please excuse me if I use my towel and tissue papers. So, I think that's a sign of health. That's what they told me. So I feel okay, but it's not very nice. Okay. Mm. Mm. Okay. So one thing that I would want you to understand is when we talk about anxiety, there are so many different ways when we can feel or describe about anxiety. In a medical condition, we have anxiety disorder. Under anxiety disorder, there are so many different subtypes. Today, we do not need to know about anxiety disorder, who needs medication, who needs this, who needs that. During our lifetime, we experience our emotions at different levels. Sometimes it could be very intense, sometimes it could be very mild, and sometimes it could take a long time. Sometimes it's a very short period of time. Today, I want you to understand the difference between anxiety disorder and fear, worries. So every time, in Mizoram, I think it's very prominent that they come to us and said like, oh, I have panic attack, I have anxiety disorder, I have depression. In the beginning, I used to believe them, but now I know that that's only a statement. Okay, that's only a statement, meaning if you really suffer anxiety disorder in some form, it's very painful. So we should not use the word anxiety we should not use it in our normal conversation, because anxiety is a disorder. On the other hand, we need to understand what fear means, worried means, being scared. If we do not experience fear, if we do not experience worry, if we do not experience like being scared, afraid of something, that means we are not normal. So it is so normal to be afraid of something, to worry about something, and we can't sleep for some time. It's normal. We are a human being. We are emotional being. Please remember that. We are an emotional being. So we need to be willing to accept our emotional life, which includes fear, anger, sadness, happiness, joy, surprise, disgust, any form of emotional life. So what I want you to understand at this situation is, when someone is having a disorder, okay, that is medically diagnosed as disorder, they cannot function as normal, or they cannot function, they cannot, let's say, self-care is not possible. They cannot do their job, like maybe a student, they cannot study, a teacher, they cannot teach, an office worker, a clerk, they cannot do their job, they stay at home, they cannot relate with other people. There are so many different ways that that disrupts the normal functioning of a person, and that is called a disorder. Yes or no? So please do not use anxiety in your normal conversation. That is my first psycho education for you guys. It's a disorder. And you, or anyone else, we cannot just say anxiety. Let the the clinicians may be able to diagnose in a proper assessment. And they need medication, they need severe therapy, long-term therapy. Okay, so for us, when we are afraid, when we feel nervous, it's so normal. So today, what I'm going to talk is how to manage that excessive fear, excessive worry. Am I clear? Not anxiety per se. So I wish, let the campus not talk about anxiety, depression. You can talk about sadness, you can talk about fatigue, you can talk about burnout, but not depression and anxiety. Is that clear? So today, you need to understand the difference between a disorder and an emotional experience which a human being needs to go through. That's all. Having said that, you might have experienced yourself or your friends as person who could not do their own occupation, cannot do self-care, cannot come to class, cannot socialize. Then you might need to refer to your coordinators, and they might need to do something else. Is it clear? I would like to request you, all the students, or even the faculty, could you please contact, if you could find out those people within the campus, then you can refer it to the counseling cell, and they will know what to do then. But and one warning, if you have your own issues, if you don't feel good about yourself at that point in time when someone is sharing you something, please do not listen to whole stories. Can you please refer it to the counseling center? It is not healthy. When I am not healthy, okay, I can be very sad today because my dog had passed away, just for an example. So I don't feel good about myself today. So my friends have come and then they wanted to tell me certain kind of sad stories. I might say, I'm not in a good place. Could you please just go to the counseling cell? And that is the first self-care as a person that we can do. We can love ourselves by doing the first self-care, okay? Knowing our own status, knowing our own situation, knowing our own emotional state, we can seek and do referrals outside of ourselves. That would decrease your own worries and fears and sadness, because anxiety and depression is more or less the same. So I will interchange with sadness and fear, okay, today. So I don't want depression per se, but I will talk about like two sides of the same coin, sadness and fear, sadness and fear. So that could be a normal experience for every one of us. Is that clear? Yeah. So when I talk about sadness, it's a normal human experience. And if you say that, no, I can manage things, I don't feel sad. Either that person is not in reality or telling a lie. Because we all do feel sad. The intensity may differ. Okay? So likewise, today I want you to understand that anxiety is a disorder. A normal experience is fear, worry, but at the same time, we can have excessive fear and excessive worry, like exams time. It's very sad that we've heard the news that there was one beautiful girl from Siaha who committed suicide, I think yesterday. Very, very sad. The reason being, when they have like excessive fear or shame, we can't think straight. We cannot think positive about the future. That is the impact of excessive fear, excessive worry. That I want you to understand today. Worry is fine. Fear is fine. The excess, the unnecessary things. One tip that I want to give you today is how do we differentiate between excessive fear and fear? Okay, when you take a situation and when it is realistic, like if a tiger comes here, will you just smile and sit here? What shall we do? Normal response. I think, yeah, sir will jump, no? I think he will be like very good in high jump as well when the tiger comes, right? So we have that natural response. So it's natural, it's realistic. Like if a tiger comes and trying to, look at us, somebody might freeze. Freeze means cannot move. That's also a response. The flight also, the running away part. But there are people who would also want to fight. Okay, Dr. Mai might want to fight the tiger. Okay, that is the fighting spirit also there. When we've been exposed to some feared objects, we tend to have those kind of responses. Either we fly and then fight and also freezing. And we feel numb sometimes. Okay? So if you are in that position, maybe you need to rethink whether it is realistic to be afraid of that tiger. So we all say it's realistic. However, if the feared response here, the fight or the flight or the numbing, the freezing part remains for 1 week, and then you could not do your normal work, you're still in that position, then you need to rethink. Oh, maybe it lasts a little bit longer. So what's going on? So sometimes fear holds us back and then it stops us from living a life. It stops us from thriving, enjoying our own stuff. So one tip is that you need to understand whether your fear and worries are realistic or not. So when all of us, our fears are different. Our responses are different. However, the difference is it realistic or not realistic? It's so realistic to be afraid of a tiger. Okay? My unrealistic fear, I don't like pets. It has nothing to do with them, biting me or things like that. I think I just don't like it. Okay? If I just don't like it, it is fine. Okay? I won't punish them or things like that. But I'm afraid of them. Like when they come, I was like, tend to get that stiff. It's very unrealistic because I do not have any experience. They are like very smooth sailing people. Okay? So it's a very unrealistic thing. So now I started to expose myself to some puppies. Now at least I can touch them. So there are objects, very unrealistic fears in their life. So it's so okay. We just need to approach it differently. We need to, make ourselves reduce that fear because it is so unrealistic. How many of you do have unrealistic fears? Think about it. Anything. Spider, lizards, cockroaches, storm, rain. Yeah? You don't have? Yeah? Yes. Sir, can you please tell me what is your unrealistic fear? Ghost? I love that. Who would love to hunt a ghost? I think, oh yeah, two of you. The next, okay, they can take you there. Yeah, I'm just joking. Yeah, I'm just joking. So what I'm saying is that, yeah, we all do have fears. My nephews, they come with me. Okay. So we need to rethink about our unrealistic fears and our realistic fears. Unrealistic fears, we try our level best in terms of grading. Grading means, suppose ghost. You might not be able to expose yourself to a ghost movie. There's a ghost hunting thing you do, but don't go there. So you can start reading about, not exactly as ghost, but what stories that you can, there are quite a number of stories that has a ghost thing. So you expose yourself slowly in the idea of ghost. The idea of ghost. Because you are afraid of the idea of ghost, not the ghost per se. How many times have you had an encounter with a ghost? A female ghost, a male ghost? Okay, fine. So it's the idea of a ghost, right? So sometimes we are afraid of the idea of a ghost, the idea of a dog biting a person. Does that make sense? The idea of something, but not the reality. So that's why it is so painful to to have some kind of fear over the idea, because it stays here. If ghosts might come like 3, 4, at least they will disappear sometime. And then the moment you leave this room, then you'll be fine. But the idea of a ghost remained here in the head. The idea of a ghost. Everywhere it travels with you. So that's the problem now. Does it make sense? Not necessarily a disorder. So I really wish you know the difference between a disorder and unrealistic fears and realistic fears as well. And like suppose, like in Bangalore, when we go on the roadside while it's raining, the problem we used to have is they put all the electrical wiring, like, below the road, that side. So, and when when it rains, like the water will come up this, and it's quite a little bit dangerous for electrocution. Okay, so it's a little bit dangerous at that point. So Bangalore, when it's raining, then we need to be afraid of those things. It's a very realistic fear. But if I say that, no, it's okay, it will not come. It will not come. I will not be electrocuted. And that is very unrealistic idea. Either I be up there or down there, who doesn't want to live. The funny thing is, I used to give an example. What is a normal mental health, statements? When you go to the hospital, you have a monitor like this, no? That when they monitor your heartbeat, your blood pressure, whatever. And then we used to have 3, 4 lines here: red, green, blue. So it goes like this every time. So when you are up there, there is no other things. When you go down, and the signal, this one, will go straight. When a person is happy all the time, and when a person is sad all the time, when a person is afraid all the time, then we need to seek help. Because when the monitor stops beeping like this, it falls straight. That means death. So always happy, always sad, always afraid of something. Always, I'm talking about always. That is a concern. Otherwise, ups and downs, it shows that we are still alive. If you still can be happy, if you still can be sad, if you still can be afraid of something, you're normal. Beware where you can no longer feel other emotions rather than like sadness or fear or happy. You must have experienced like great comedians do have depression, because that's how they cope. Sometimes we think a happy face can change the internal state. Sometimes it can, in a normal range. However, if it is constant, it cannot change. It's just cover up like a makeup. No? So now I put on lipstick. If I drink water, a little bit of my lipstick will go. So the shade will be lighter, right? So the more you use makeup, the more, thicker your face will become. So face washing will be very difficult. So manage your anxiety, your fears, your sadness, your high mood every day. And that is more than enough. Otherwise, if it is a disorder, then you can refer it out to any kind of, resources like Counselling Center. Am I clear in helping you understand what normalcy means? Are you normal now? Are you normal now? Suppose if I say, okay, I'm going to ask you some psychological question. How many of you will say, oh, yes, yes? How many of you will say? How many of you will respond to me, yes, yes, ma'am? Who would say? No one. That's normal. You're scared, you're afraid, here and there. That's normal. So we need to understand what normalcy means, and please do not label yourself or anyone else, because I don't think we do have the right to label them. Their experiences are real. And if we cannot treat them, labeling or diagnosis is important for the treatment. If you cannot do the treatment, you cannot label them. And please do not self-diagnose. Please do not self-labeling yourself. Oh, I have depression. I have this. I have that. I have this disorder, that order. Because this is the area which we should not take it lightly. You and I do not have the right to announce the diagnosis of a cancer, as much as we do not have the right to diagnose some medical condition as well. Does it make sense? Yes. So I think that is one of the the message that I would like to give you today. Be normal. Just check whether your fears are realistic or not realistic. Now the management part. So when you do experience this kind of excessive fear and worry, normally fears and worries relate to the future. Yes or no? Like suppose, oh, will ma'am ask us questions? Or will she give us some questionnaire to disclose personal information? I might do it. Is it okay? Yeah? Very good. There might be some people who's not okay with it. That's also fine. The reason being, we have our own fears, we have our likes and dislikes. It's fine. So when you have that, we are afraid of something which is not yet happening. One quick, realistic way of taking it away is that you do not know whether you are going to be alive. How many of you are sure that you are going to be alive tonight, 12 midnight? Please raise up your hands. I'll give you sweets. We really don't know. None of us. So, is it worth sacrificing our present peace? Is it worth sacrificing? Yes or no? No. We can have plans. We can have our fears and concerns. If we do not have concerns about the future, we are up there or down there. So we are not alive. We are not a normal person. Having a concern is fine. But when that concerns, has an excessive way of controlling us, like the topic that you have, like, what is the topic that we have? Manage anxiety before it manages you. Yeah. Before it takes you over, we need to go down. Like, suppose 2-3 days is fine. Not feeling like, feeling tired, fatigued, fidgety, restless, it's still fine. But if it persists for more than 1 week or 2 weeks, that's a concern. Otherwise, no. But the first thing that you need to understand is whether you are going to be alive or not. We really don't know. The only thing that we have right now is my now, my present. It's worth living. If you live in the present, your worries, your fears can reduce. Because please focus in your present. When you sit here, sit. When you drink tea, drink. When you go outside, when you go to Tlong River, how many of you used to go to Tlong River? Yeah, 1, 2 guys, yes, I know. Lots of spots, right? These days it's very common. So, if you go to Tlong River, just enjoy. If you want to watch a movie, watch a movie. Don't eat and watch. Do one thing at a time. Give a time slot. Okay, relatable. How many of you use your phones while you were eating? Yeah? Hi. I'm not going to punish you. Yeah, quite a lot. Yeah. They are there, 2 guys. They also do the same thing. Sometimes they watch TV, sometimes they use their phones. When you do that, multitasking is fine, but not eating and gadgets. Multitasking means I can hear something and I can type it or do some other work here on the table, but not with the gadgets. Either you undereat or you overeat. And also, it could be a distraction from your concentration, and that would also increase your, your feared response. You don't like silence. So next point, silence. Learn how to be quiet. Meaning, if you could spend 10 minutes in silence, not to think, not to do, not to hear, not to say, just be yourself. You will understand where you feel uncomfortable. Those are the points that you need to recognize, write it down, and then check whether it is a realistic disturbance or unrealistic disturbance. Does it make sense? Yes or no? I need response. Yes? Because if I want to move on, then I need response. Okay? So the first thing is you really don't know whether you're going to be live or not tomorrow. Okay? Live. Dead or alive, like Bon Jovi's song, there is a dead or alive. There's a Bon Jovi. Do you know Bon Jovi? No. Old school. Right? Old school, yeah. We love them so much, but I don't know about you guys. So, dead or alive. Number 2, understand silence and you. How do you relate with silence? If I cannot spend my few minutes without any distractions, like telephone. Telephone is a distraction. How many minutes can you sit still? I really wish I could do this here. Are you okay with it? Yeah? So the reason this is so important because we've been exposed to the world, let's say the globe, even to the Mars through Elon Musk, okay? We get the information, we receive information, the universe. Even though I don't know anything about the universe and physics, people are so good in informing me in my own, in those, small languages so that I could understand. Meaning, information is overpowering, hovering like an atmosphere, like an oxygen. We need to learn how to pace ourselves, not in the internet pace. We are human beings, not electrical gadgets. We are more than electronic gadgets. We are more than research. We are more than electricity. We are more than physics. We are more than chemistry. We are a human being. These days we were talking about IA. Good, fine. There are certain things that's very, very good, especially in surgery and things like that. Artificial intelligence, AI. However, who created AI? Human beings. We are more powerful. It's just that we are limited. Because we are human beings, we are created in such a way that there are certain things we need sleep. Okay? Robot, they don't need sleep, but then they switch off like this. So it's in our hand. So we need sleep. We need to eat. And we need that energy, 3 things. When we have excessive worries and fears, we do not have this. So if you do not have a pen, how can you write your notes? Our pen is like sleep, food, and energy. So if this technology takes away our food, our sleep, our energy, is it fair for a human being to be controlled by internet and electrical gadgets? Is it fair? In a Christian belief, we often talk about Satan everywhere, okay? But the thing is, when God says like, hey, do not have any other gods, meaning is, do not bow down before something. You bow down, you committed yourself to this gadgets. Is that clear? Yes or no? If you bow down to anything besides your food, your sleep, and your energy, your body, after some time, will betray you as well. Your mind will betray you because you don't love it. You don't love your body will betray you. And your stomach will betray you because you don't love it. Does it make sense? So love your sleep, food, and energy. That will help. So the first thing in which we can do is just close your eyes, relax. Okay, I'm not going to throw anything at you. Just close your eyes Relax, okay? Just close your eyes. And we'll be here, we'll be doing the silence for 2 minutes only. Don't think. And the time starts now. Okay, you can open your eyes. So, how was it to be with yourself? Do you like her? Do you like him? Was it comfortable to be with him or her? Of course. What's going on in your head during that time? How many of you could just relax and sleep off? Yeah? Good, good. How many of you could not do that? How many of you experience certain kind of distractions? Okay, very good. Okay, was it comfortable, not comfortable? Yeah? Comfortable? Okay, so you were thinking about happy thoughts? Intentionally? Okay, so, there are times when we cannot just stop thinking. Okay, so when you go home, learn how to stop thinking. It is an exercise which you need to practice every day if you want to have a good sleep, if you want to eat well, if you want to have an energy for the next day. And there are times when, people who have so much of excessive worries, even if they sleep for 5 hours, they still do not get that, they could not get up in a very energetic way. They feel fatigue. Anyway, so when our brain, when our hard disk could not stop, could not stop the function, it's so tiring. It will come to the body again. Even if even the best of machines needs to be shut down sometimes. Our brain, even though it's active passively, it comes as a dream as well. So many things, but at least from our part, we stop giving information. We stop the brain from working here and there with all the neurotransmitters and everything. Okay, so Your brain deserves to have a break and a shutdown. You may not want it, but your brain needs it. So that as long as this is healthy, then the rest of the things will fall into place. So one thing that I want to tell you, so you understood, no, you connect with yourself, and now this is the way in which you can help yourself. If your thoughts, they are so, people are different. We receive information, we act out depending on our own choices. Let's say, if I'm a thinker, if a situation happens, I think first and then I act. If I am a thinker. If I am an emotional person, there is a situation, I feel it and I act. And there are people who do things first and they feel or they think late. Right? So in a way, like, just examine yourself. Who are you? Where do you start your own actions? Are you a thinker and do action? Are you a feeler? Do action. Or you just do and feel and think something else. Who are you? What are you? Think. Do you understand what I'm saying? Do you think first, act second? Do you act first, think second? Do you feel first and act second? Identify, you don't need to tell me. This is for your own exercise at home. So if you could identify, oh, I think, or maybe you can change. I just give you an idea. You can redo this at home. If you were a thinker, you really need to understand that there is a realistic and unrealistic. Emotion-wise also, realistic, unrealistic. Action-wise also, like, suppose if I love to help people, if I'm a social worker not in academic sense, but if I want to do social work outside of my community or my academic platform, I need an extra time. In that time, I might be able to sacrifice my own space at the expense of others. Is it realistic? Yes or no? Can I sacrifice myself to do extra work? I cannot. Because I need to protect myself first in order to help other people. Because that is the theme, or that is the chorus that we used to sing. If you cannot help yourself, you cannot help other people. That's the mantra that we used to say every day, every time. If I cannot help myself, how can I help other people? I need to help myself first. I need to know where I stand. I need to know my fears, where my fears are, how can I control myself, and this and that. So, one thing is, if you are a thinker, just listen to your heart instead of feeling. Because these days, feelings like people have some reservation. It's a manly thing. So all the boys, would you like to feel? Yes or no? Sometimes may not, because it's not according to the society. We have a movie called Boys Don't Cry. So, but we allow you to cry. Okay, it's healthy. So what we need to understand, if you were a thinker, if you do things from your brain, like you think and you act, sometimes your thinking can be influenced by fear and you will make wrong decisions. Is it clear? If my thinking pattern is influenced by my anger, do you think that I could use my head clearly? No. So decision will be colored by the anger. So it's going to be very unrealistic or dangerous. Is it clear? So I need to have my brain, my thinking pattern, not to be colored by some excessive emotions. I would not say negative emotions, but I would say excessive. Excessive happiness. There are people who are in a habit of, giving away things when they're happy. They regret it later. So bad, I won't do that. Okay, because I love my things and I don't want to give out like that. But there are people when they're in a happy state, they're so happy and they see other, needy people, so they give out. That's also excessive emotions, right? So when we talk about happiness and sadness, there is not so much of negativity or positivity. It's just an emotion. Please be careful that an emotion is an emotion. We do not need to label it so much as good and bad. There is no good and bad. If you cannot feel sad, you will be like a robot only. So be happy when you can feel sad, but don't let it prolong so much. Before that, you need to think that. And so when you are thinking, don't make decisions when your emotions are, coloring your thinking pattern. Actions, as I said, when a person is too happy, the feeling person, so happy, oh, I think I'm so happy, I don't need any other things, and they give out. So their actions have been colored by a happy emotion. But the result is like that. There's so many giveaways like that. They're in a habit of doing that. Okay? So sadness, happiness, we act differently. And there are certain people who'd like to experience things, to do things first, and then feel it later. Like suppose, that would be, if they want to learn something, they just want to take risk first. Does it make sense? When they are angry, they want to take risk first. So reckless drivings and so many impulsive behaviors will come out of that. Or so many risk taking without knowing the pros and cons. They make decisions. Sometimes it could be fatal, and sometimes it could be, lifelong illness. It could be anything. Let's say if someone wants to harm himself, herself, they want to feel it first, so they cut. Otherwise, they cannot feel. If any one of you here who used to do some physical cutting or self-harming or even suicidal thoughts, it's not worth it. It's not worth it. You should not blame yourself for doing that or thinking about it. But the issue here is, you can reach out to people who will not judge you. And don't judge yourselves and try to manage your impulsivity. So try to think first and then do. Don't do it and feel it later. Don't do the action first. Sometimes we do feel sad. We do feel so hopeless and helpless. So there might be a time where we think about harming oneself in so many different ways, but it's not worth it. That's what I want to tell you. So one is, you don't know, it's being alive or death. We don't know. We don't need to worry. And what's the second point that I mentioned? Be with yourself, identify your emotions, the things, and now your thoughts, your feelings, and your actions. Please examine yourself and then try to identify and then check whether it is realistic or not. Is it clear? That's all I can say today. Now it's 12:30, so. Okay, question? Okay. Any clarifications that you would like? Oh, okay. Chandra vangai ombe. Tiro. Katung. Zakbok silaw. Why do we say something to others, friends and family members, that will hurt them? Knowing that it will hurt them, is it normal? After to say things that we feel bad, at the same time, we feel like, this is like, okay, you hit me. So the same kind of wound that I am going to give you back. Either this is very passive aggressive behavior, meaning it's like an eye for an eye type. Is it normal? Eye for an eye? Sometimes maybe. But then the problem comes when we feel guilty in the end. That's the problem. The eye for an eye part may be not very dangerous, but the moment you feel guilty about it, and that's very painful. Yeah? So is it worth to do eye for an eye if you're going to suffer alone later? So you calm yourself, okay, that person. So this is a time where we need to make use of assertiveness skills rather than hurting them back. Okay, this behavior, assertiveness skills will be very good for this. What can we include in self-care? Or what do you do? Do you think AI will replace human beings? AI can never replace human beings, but it will take away quite a lot of jobs. Your income will be down, but it can never replace. According to me, I am speaking from 2023, but I don't speak for, 30, 20. It might be there, I don't know, but not now. Because I live in the moment, I don't think I can take up with this thing. Okay, is self-care very simple. You get up in the morning, do your own cleaning up, go prepare yourself, eat your food, do your work, occupation. Occupation can be becoming a student or a teacher or whatever. Do your stuff. Play with your friends, play with your family members, talk to them, watch some news, and go to church sometimes. Then do your YMA activities if necessary, then sleep. That's it. That's a self-care. One day care is more than enough. Please do remember that. Do your own stuff. Okay. One day at a time. Use that as your thing. What should I do when I get too anxious to the point where I get too frustrated? The only thing that suits me is harming myself or outing out aggressively. So too anxious to the point where I get too frustrated. See, we all do get anxious at one point. This is mostly about maybe guilt. Okay? Guilt. When I feel guilty of something, it pains us. Sometimes we need to forgive ourselves because of our mistakes. We do not need to punish ourselves every time. Even if we have some scars in our body, it's so all right. That was your experience. It doesn't need to be your present. It doesn't need to be your future. Anger management will help you. You need to understand your anger, accept it, and learn how to do that. So anger management will help. Do your own hobbies. Hobbies can help you, I think. Do something fun that you enjoy. Not necessarily, you do not need to learn other skills. Whatever things that's already in there, use that as a distraction for a while. But anger normally gives out this kind of expression. And anger could come from guilt as well. What mindset shall we keep during classroom management? What advice would you give to us, be it students? Depending on the developmental age. Okay, this is from the B.Ed students. Teaching is about trying to give or trying to insert the information to the mind. So you need to, firstly, you need to think about the developmental ages of your students. Like, if you have a student around 6-7 years of age, and below that, their attention span is about 6-7 minutes. So, what do you want to insert within that 7 minutes? Does it make sense? So, you need to understand the kind of students that you have. Like, suppose if you are, okay, I used to work in some of my students used to go to slum area to do their practicum. When they come for supervision, one thing that we notice is slum area, smoking weed is like drinking water or tea. Because for them, there is no other recreational activities. The grandparents, the parents, the elder brothers, elder sisters, they're all smoking. Because they did not know the harmful effect of weed. So one day we organize awareness campaign. And most of the students below 14 years of age, they said like, oh, I'm going to stop because I want to become a doctor. Just like that. Sometimes the way we say things to our students means a lot. Because for them, it's a lifestyle. We cannot take away their recreational activities. However, we talk about the harmful effect of that recreational activities. Then they decided not to take. So, for teachers, I think in one way or the other, we are going to be a teacher anyway. As a mother, as a father, as a sister, as an aunt, uncle, we're going to teach anyway. So it's so good to talk to the person depending on the developmental age. I think, be it students, you might learn the developmental stages. So make sure. By committing suicide where their victims does it out of this or the courage or bravery of not being afraid to die. The courage or bravery of not being afraid to die. I don't know about that, but I think sometimes it is courageous and challenging to live. Yes or no? So many ups and downs. So many ups and downs. At the same time, when a person decides to commit suicide, sometimes it could be accidental. You need to remember there is an accidental suicide. Okay? Not every suicide is like, desired. It could be an accidental. They try it out and things like that. So, like that. So whatever it is, when the person, thinks about suicide, they just want the pain to go once and for all. Meaning is they lose hope. Meaning is they are not willing to find the other options. There's so many options in life. Don't give up on that options. If you cannot find the options, seek help. Talk to someone. Options. Especially these days, there's so many, helpline or persons. So I find courage and bravery to those people who have the courage to live in spite of all the challenges. And that's bravery. Who's willing to navigate through their lives, navigate their life through these challenges, and that's life. Sometimes it's painful, but people are willing to find options. So, I don't know about whether suicide is courageous act or bravery. I find life more challenging. Okay, a family member is loudly expressing her happiness and anger, has likes and dislikes. So she causes me enormous stress at home where I need please guide. How do I cope? Use your, what is it? We have a mobile, we have a earphone. I'm just joking. When someone is having this kind of behavior, it's very irritating sometimes. But she might be your or her. She is a family member, you cannot avoid. But we tend to speak out depending on the uncomfortable feeling that we feel. Sometimes you need to accept that, oh, that person has some issues. Don't take it as your issue. You cannot control her behavior. At the same time, you cannot take in what she's saying. They just love to create this kind of noise. It takes courage and patience to be with this kind of people. So be brave. Yeah. So that's all I can respond, and I thank you so much for the question. Then maybe we can respond to it later, right? Yeah.
Thank you, Miss. We are all in the group. I think the coordinators group and the prefect group like that. So Miss will be responding through the WhatsApp group also. We will be requesting her because it will be difficult for her to respond to all the queries and the questions, and she might be tired also. As she said, we have to be, good to our body also, our rest, our stomach also is calling us as of now. So I think lunch will be ready. So we will be answering to that call, hopefully. So we'll break for lunch. We will take a 15 minutes break for lunch. And then after that, we'll come in for the next, the afternoon session will be started in 15 minutes. Okay, let's break for lunch.
The afternoon session, I think that in the forenoon, we already have a very fruitful experience regarding anxiety and what we're supposed to do. So in the afternoon, we have an expert, an invited guest among us, who is going to talk us more about psychological first aid regarding what we are supposed to do. One thing I want to say is that among Mizos especially, that we think that the mind, when our mind is in a problem, we feel that we are at problem ourselves, thinking that it is our fault. If our body can fall sick, then our mind can also be sick to a certain extent. And when we fall sick, what do? We take medicine or we take certain treatments. But in Mizo society, when we say I'm having anxiety, I'm having stress, I'm having depression, people usually assume that we ourselves are the problem. But it is not so. If the body can be sick, the mind can also be sick to a certain extent. And that is not something for which we are to be blamed, but that is something which we should treat, which should be treated either by ourselves or through experts. And this afternoon, we have an eminent expert in this field in the state of Mizoram, Dr. Robert L. Khawlhring. He is the State Nodal Officer from Health and Family Welfare Department. And I don't know about the forenoon, but in the afternoon, whenever we have a workshop like this, it should be interactive. It should not be a monologue, it should be a dialogue. So we have an expert, and I think that he may have certain exercise or certain questions from us. And in that, I hope that those from the audience, we can participate properly so that it will be a fruitful experience, not just for the speaker, but for us. And the purpose of this workshop is not to be a passive receiver, but rather we are supposed to be active receivers so that we can help ourselves and also help others through this workshop and through the various exercises we're supposed to do. And with that, without much ado, I'll invite our speaker for this afternoon, and the floor is yours, sir.
Thank you so much. As you see, the topic is psychological first aid. So I was wondering how many people know psychology? How many people have a background in psychology or are studying psychology? Please raise your left hand. 1, 2, 3, 4, 5, 6, 7. Okay, 7, that's actually God's number, no? According to Christianity. So it's okay. Like the professor, good associate professor, has just told you about health. So I was just asking my colleague here, my friend here, what were you doing in 1991? He said, "May anapokala zamlao." I don't know how many of you know that. So, what were you doing in 1991, man? You were not born yet. It's okay. The reason why I go to 1991 is because that was the year that I entered medical college. And then the definition of health was still the definition that is now. Means it has stood the test of time. And the definition is health can be stated as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Okay? Now, if you were medical students, I would have gone and asked you more about this definition, but not required here. However, it talks of 3 things, 3 very important things. It talks of physical health, it talks of mental health, and social health. Now, these 3 are so important that the government decided that social health will be looked after by the social welfare department. They made a whole department. Then they said, okay, the health department should be separately. But then somehow, in the rush of things, mental health took a back seat because of that. No? It took a back seat, and therefore people don't know much about mental health. But I was so glad to hear from the introduction and from the opening point that just like your mind, your body can be ill, your mind can also be ill. Therefore, we go to psychological first aid. Before we start, sir, I would like to ask 10 questions. In fact, I had made a pre-test and post-test, like something like that, but I thought maybe I'll just say and then get your inputs. So, according to the topic, if you just see, it says psychological first aid. So, what is first aid? Psychology, we'll talk about that later on. What is first aid? Yes, ma'am?
The first thing we do to heal or cover up our wounds.
Okay. Suppose it was a psychological wound.
Maybe a talk therapy.
Okay. So she's actually right. The first and immediate thing which we do is called first aid. Now, when can you do it? Yes, ma'am. The red shirt. I don't know your name, so. हाँ जी? हम कब करते हैं ये? When do we do first aid? Psychological first aid. When do you perform? Absolutely right. Immediately. Immediately when the need arises. Who can do it? Who are the people? I need some guide. Yes, sir. Who can do it? Who is equipped to do it? Sir? Is your mic on? Is it okay? It's not working.
Yes, I think it could be anyone who can help. Anyone who is nearby, I think.
Okay, so anyone who is close by can do it. Do you need an RCI for that? MCI, NCI, do you know what is NCI? What is NCI? Nurses Council of India. MCI would be Medical Council of India. RCI would be Rehabilitation Council of India. Actually, it helps if you have it, but it doesn't need to be. Okay, so we had 6 questions, but we will not go into each and every one. I think most of you have got it, so I'll just go by the presentation. Yes, sir, can you please move to the next presentation, the next slide? Okay, here it says what it is. It's something very simple. Simple. The magic terms and the magic words are, it is very, very simple. Okay? Yet powerful. This is something which I wanted to emphasize. It is something which is absolutely simple. Anyone can do it. And who needs it? Anyone who is in distress. And that's why we go back to COVID. That time, we had more people who had distress rather than the disease or the disorder. And therefore, we will also talk of telemanas, the telephone aspect of how to call mental health. That also we'll talk about it. This is just a simple way to say that whatever you do in psychological first aid is very simple, very humane, yet very powerful, and for the people who are in distress. Next, sir. Okay, who? We have already answered this. Go to the next, sir. Anyone. Now here, I would like to say that mental health professionals, it is best if they can do it, but we are so limited. We are not even 100 here in Mizoram. So, therefore, the end of the line which says first responders. Who are the first responders usually? YMA. So, everyone should know what psychological first aid is and how to do it. Next, please, sir. When is it required? I think you have already answered this, but we'll see what is written in the slide. See, what is important to know is that it may be a natural disaster, it may be a man-made disaster, it may be a public health emergency, or as simple as a personal crisis. Okay? When patients come to us, sometimes some of the people say, oh, avan hove, bialu itenamo, and you're it's not that simple. To them, it's a crisis. What matters here is how they feel. It is something almost similar to counseling. There, what we usually do is we take the person's agenda, which is more important than what our agenda is. Next, please. Okay, this is a very, very interesting slide. Now, the reason why we had kept this here is that if you ever know triaging or triaging, I'm told that it is supposed to be pronounced as trier. It came from the word trier, so triage, but you may call it triage, no issues. We are Indians. On top of that, we are Mizos, so triage. So triaging, what is important is that there are 4 color codings, 4. The 4th color is black. Black means moribund or dead. So those people, you will not waste your time. Your valuable time in mass casualty setting, even now, even today, we got a call the office, directorate, got a call from the secretariat, the chief secretary, Dr. Renu Sharma. She had told us to warn everybody regarding the impending cyclone that is about to come, and she personally wanted me to call up Saiha and Longklai. I said, ma'am, we have already given them a notification, office order is there. She says, no, that is not enough. You call them up, call the CMOs, call the DMSs and tell them to be ready. So what I'm trying to say is that emergency is something, if you are prepared, the destruction or the destructive property of that, say, that event is less. Whether it is something like a cyclone or a personal crisis. So we should be ready. Anyway, so these are the 4 colors. Red is something like those people who need immediate attention. Yellow or orange is somebody who can wait a little bit. It is priority, but say they don't need your immediate attention right now. Green is somebody who is a walking wounded, they can wait, maybe a few hours to a few days. Now, why am I telling you all this when we're talking of psychological first aid? Because when we have to determine who should be put in red or yellow or green, the color coding comes, okay. How would you put them? Anybody has any idea of triaging? Yes, Ming Moy, you've got idea? Any idea? Okay. You look for only 3 things. They said even the YMA should be able to do it. Only 3 things. First thing is respiration. Count how many breaths they breathe, how many times they breathe in 1 minute. It should not be more than 30. Okay? So it should always be less than 30 to be for an adult. I'm saying this is for an adult. Second thing is perfusion. And now it's a little difficult to understand when I say perfusion, but it'll be very easy when I explain it to you. We just want to see if the person has lost any blood or say is having less fluid in the body. Please raise your left index finger and press it on the nail. It becomes white, isn't it? It becomes white. Release it. Does it now become red? If it takes more than 2 seconds, means you have lost blood or you are dehydrated. Means it should be less than 2 seconds. And the third thing which pertains to us here is mental status. Okay? That's what brings us here. The third thing, very important to determine this, is the mental status. What should we look for in mental status? What should we look? Just a minute, ma'am. Oh, hello. I'll call you. So, we were into the third thing, which is the mental status. What do we look for? Anyone from the back? All those people who are so interested to know, but looking here and there. Yes, sir. What is it? What would you like to know in mental status? Like if the person needs to be put in red category, yellow category, or in green category. Orientation, for example. You should look for orientation. If the person is oriented after an accident, or even a personal trauma, if a person does not know where he is, we usually look for 3 things. TPP, we call it. Time, place, person. And in this order. The first thing to go in orientation is the time. They are not oriented to time. They don't know. We tell them, look out, sir, madam, and tell us whether it is morning, afternoon, night, evening. So they'll look out. If they say, I think it's 12 at midnight, it's wrong, something is wrong. So something like that. So you look for orientation and you ask very simple questions like see, TPP are we looking for? No? So time, place. The next thing to go is time, place. So where are you at present? Sir, which floor are you here? In which floor is this? Third floor. So this is the second floor, sir. Okay, maybe you said second, I'm just trying to pull your leg. This is the second floor. That is called ground floor. Just on top of that is called the first, on top of that is second. Anything below the ground floor is called the basement. Basement 1, 2, 3, 4 till n number. Okay? So, place. And the third thing is person. So if they don't even know who they are, then it means there is something very serious. Maybe there is it's a case of concussion. Maybe extradural hematoma. I will not talk about that. There's something wrong. There's a bleeding inside the skull which cannot be seen. Immediately you have to do something. So those three parameters have to be looked when we talk of triaging or triaging. Okay? That's why it comes in the psychological first aid. Okay, sir, can we go on to the next? Where? Okay, this I think they've already answered. Let's go to the next. See, at ground zero. Very important. If there the person has a personal trauma in the class is ground zero. At home is ground zero. If it's a site where somebody very dear to them is dead, that is ground zero. So, so that's what we need to know. And of course, we have to see that safety is something which is absolutely important, because this also deals with not just personal crisis, we also are talking about natural disasters also. So if a building has fallen, just don't say, okay, you're safe here, and the building, something falls on you. Take them to safety. That's a priority. Okay? See for the safety, see that the person is stabilized, see that you connect the person to what we will see who to connect as we go. Yes, sir. Okay, this is something which may be new to you. It's okay if it is new. For any stress, for any disaster, for any problem, we have normal reactions and abnormal reactions. Now you may say, how can it be normal? We will see. Because even in a disaster situation, not everybody is overwhelmed. So to be overwhelmed may be abnormal, but there are some reactions which occur in almost everyone, which can be quite normal. Next, sir. See this. Look at this. Anger, irritability, for example. These are normal reactions. Okay? These are not something which is abnormal. It could happen to anyone. I'm not saying it happens to everyone. I'm saying it could happen to anyone. You could feel anxious. See, in the morning session, you have probably understood that feeling anxious is not as the same as having anxiety disorder. I hope it is very clear. If it's not clear, I can take some time and tell you that. Because before exams, what you feel is anxiety, not necessarily anxiety disorder. Depressed anxiety so anmani damlovin aron soya. When the patient comes and tells you, just make sure, especially you'll be dealing with patients, make sure what is the understanding of those words. They'll just come, say anything they want. I am depressed. I say, ma'am or sir, what do you mean by that? When they explain, they're talking about anxiety then. I said, ma'am, that's not depression. It's probably anxiety. They'll come and tell you, I am having panic disorder. Sometimes I say, with or without agoraphobia. I mean, if they're coming up with technical terms, and you give technical terms back, na? So, something like that. So, let's just go here. And anxious, when I say anxious, I mean just to be anxious, not anxiety disorder per se. You have to be very clear about this. And those anxiety symptoms here, we have already done in forenoon, so I will not repeat. Then feeling sad. Okay? Feeling sad does not necessarily mean depression. Mind you. But depression does have feeling sad as a symptom. All Mizos are Indians. All Indians are not Mizos. Karatyamin, something like that. Just to explain. So outcry, denial, all these things can happen. And these are normal reactions. They are normal. Do these people need help? When they have these problems in a personal crisis, do they need help? Yes, sir, ma'am, in the back. Do you think they need help? Again, done. Yes, we are waiting for your reply. I can't hear you. Ring them in. Kasha theilau. Okay, they don't need help? Okay. You are both right and wrong, ma'am. Thank you. Experts from NIMHANS, when they had come last month, and they had trained us, we were lucky to have them coming for 1 month. They told us it helps if these people also get some sort of treatment. If you give them psychological first aid, it helps. Antivya. This will get over by, say, 10 days. But if you help, it'll probably get over by 3 to 5 days. So even if you don't help, it'll be all right, but you're increasing the number of morbidity days. So they get all right by themselves, but it's easier and it's sooner. So now let's see what are the abnormal reactions. These are abnormal. These are abnormal. Now if a person has a crisis or something and is overwhelmed, they have panic, they have exhaustion, extreme avoidance, flooded states, they have all sort of psychosomatic complaints, then it means it is not normal. Here, as the back madam had said, yes, they do need help here. It usually resolves, but it probably will resolve in 2-3 years. If you help, then it'll probably resolve in a few weeks. Some may take months, but few weeks it'll resolve. So why should you wait for 2-3 months for it to resolve? There are lots of things. Being overwhelmed. I don't know whether you know about the tsunami that had happened on 26th December. Chennai. It came all the way. There, the incident was there, the paper was published. There was one lady who was stuck up in a tree. They helped her down, but of course all her clothes were torn. And they helped her down, but she ultimately, within a few days, committed suicide. What was the reason? When they found out, when they talked to her near and dear ones, she was overwhelmed with the fact that people have seen me naked. I have no dignity. She so needed this first aid, psychological first aid, but it was not provided because that time all of us were not acquainted to these situations. Anyway, that was just an example of saying it was a very abnormal reaction. And these are the people who need your help. Okay? Next, sir. Okay, let's look at the basic components. Like, if you look into different books, you'll have lots of authors telling you so many things. And I say all of them are right, because they may break it down. For example, Alzheimer's, as simple as that. In our books, it is written three stages are there. Somewhere it is written 5, somewhere it is written 7, and they're all right. It means that those 3 have been broken up into 5 have been broken into 7 stage, so they're all right. But these are some things which we see, the components, okay? Just have a look. So, if you look, assurance is something which has to be done. You cannot do without. Calm, that is something which is absolutely required. How can you not calm the patient? You cannot proceed if you are not calm. But it helps to be active also, sir, sometimes. Not too calm, okay? Then promoting something like efficacy, something like, say, a sense of connectedness. And of course, which is something very important, is hope. There was a man called Aaron Beck. He had proposed 3 things: helplessness, hopelessness, worthlessness. If a person has this, especially hopelessness, it points towards depression. ठीक है? This is called the Beck's triad. Helplessness, hopelessness, worthlessness. And most of the things that I'm telling you here basically is more experience based from what we have learned over the years of 20 to 30 years now. So how old are you?
23.
Okay, older than you, the experience that I have. So it is based on that rather than theory. Too much theory so that you'd understand. Yes, please. Can you go to the next, sir? So this, they usually tell us these three L pathum hi theng hil su aranti. LLL. And what is this? Laugh out loud. Laugh out loud. LOL and LLL would be look, listen, and
link.
Yes, are so intelligent. Look, listen, and link. There are so many things else that we need to understand. It's not as simple as just saying look, listen, and link. Now, what do you look for? What do you listen? Is there a difference between listening and hearing, sir? Is it the same as hearing and listening, sir?
No,
Sir, what is the difference then, sir?
I can't say.
अरे सर आपको बोलना पड़ेगा. Okay. Can you hear the fan or the AC? Sometimes we can hear vehicle, but I hope you're only listening to what I'm saying. There's a difference. You're right, sir. You're absolutely right. There is a difference between hearing and listening. You can hear so many things. That is a special sense. But when you focus and take in the matter, what the person in front of you is saying, you are actually listening. It could be music, it could be something as good as what I'm saying, or it could be, if you find it boring, you may not even listen. That's a different thing. So, look, listen, and link. Yes, sir. Can you go to the next? Sir, please have a look at this. We talk of looking. What do we look for? You have to look for understanding. You have to look, listen, hear, ensure that there is no further harm. You have to make sure that you empower about information, social connectedness, support, that is, and of course, encourage professional help. So, ma'am, who would you say are the mental health professionals?
Those who have been trained in mental health awareness, or
So, who are they, ma'am?
here in the university, that would be the counseling center people, as well as those who have been assigned in different departments to be the counselors for each department.
You're partly right, ma'am. You're partly right. I'll tell you why. There is something called Mental Health Care Act 2016. 17. Mental Health Care Act 2017. According to that, a mental health professional is psychiatrist, clinical psychologist, psychiatric social worker, or a mental health nurse. It also includes an Ayush doctor who has had a postgraduate degree in psychiatry. Okay? Only these, as per the Mental Health Care Act 2017, are the mental health professionals. The other are mental health workers, maybe. But we don't call them professionals. So encourage professional help. When we say this, here I mean those people. I also mean what you said, ma'am, for general what you said is partly right, man. The right part is that we also encourage spiritual help. It's also very important because we all, more than 95% Christians. So it's very important that if they want to go to a pastor, we say, most welcome. We don't say, we are smarter than them, so we don't say like that. We say, okay, we may be better good looking, but you may go to them. Okay? Next, please. Okay, have a look at this. Situation is so very important, external and internal. External as in, we already talked of disaster situation. So, in disaster situation like the Nepal earthquake, if you remember, and recently, if you know that the Middle East, Turkey, these places, the buildings were collapsing like cards, a house of cards. So you have to make sure that the external situation is safe. And when we say internal here, we also mean physically internal, we also mean mental internal. Okay? The person should be free of internal crisis, or if not, then they need help. And what is very important is the individual's concerns, not your concern. Nangni khatsuan, you may be concerned about what we will eat. When they say, because when just an example, analogy is that when two people get married, only those two people are thinking of something else, all the other people are thinking about what to eat and what other people are wearing. But those two people think of something else. That's a different thing. So, we have to be concerned of the individual's concerns. That is very important. Not what you are concerned with. Of course, suicidal ideations and thoughts, these are important because you can actually lose a life. Personal crisis, people can lose lives, so this is very important. If you have time, ask about antecedent problems like as simple as appetite and sleep. That could be leading to some problems later on. And then, of course, physical problems which we sometimes don't care, but they are very important. BP sankanaya and they could have hypertension, they could have diabetes, they could have so many other problems. So please keep that in mind when you are looking and understanding. Next, please. Look at this. This you already know, especially the psychology background people will already know. The other people are also encouraged to please listen without prejudice. Listen actively. There's a difference between active listening and passive listening. I hope you're all active right now. Empathetic. There's a difference between empathy and sympathy. I think ma'am can tell us, no? Sir, ma'am, can you please, because the other people also need to know what is the difference between sympathy and empathy.
Thank you for the question, sir. Sympathy in plain word is just feeling pity for someone or something. On the other hand, empathy is like you have the cognitive and the affective component of empathy, whereas you try to understand and experience what someone is going through or experiencing. Affective. Cognitive and affective is the understanding and the experiencing part of empathy. So, like generally, when people ask what is empathy, they say that it's like putting yourself in someone else's shoes. But if you don't know the shoe size, then that becomes a problem. So there you need to understand the emotion.
Thank you so much, ma'am. I would like to add one more thing which of late I have been told about empathy. Empathy, like madam said, sympathy is just feeling sorry, isn't it? As simple as that. Empathy is putting yourself into that person's situation. So putting into that person's shoes, provided your shoe size is the same. Huh? Okay. There is one more step beyond that. Recently I was told, if you sympathize, you feel sorry, you walk away. If you empathize, you do not walk away. You take action. If you really empathize with the people of, say, Syria, then you take action, you donate something. You donate your watch, shirt, something, even money. The amount is not important. What is important is that you are taking action. If you empathize, it should be followed by action. Otherwise, you are just sympathizing. Antiane. That's a difference. Okay? From now on, I hope you write that in your answers. Madams will give you good marks. Is it, ma'am? So next, sir. No, sir. We are still on point number 4. So, as we already know in psychological, when we talk of counseling, leaning forward. Yes, ma'am. What were you saying? Something like that. You're just trying to ensure that you are actually listening to what they have been saying, not just hearing them, but actually listening. So these things are very important. Okay? And then you summarize. Please. That is what you said. Is it that or something else? That concept, please do. Especially when you talk to your friends, if patients are involved, then patients. Next, please, sir. This is very important, of course, no further harm. So dignity we were talking about, and here was the example that I wanted to give, which I already gave, about the tsunami, the lady who had committed suicide. The dignity, what they feel important is very important, okay? Treat them with dignity. That part, if it's not there, we could lose lives. So it may seem so very, say, subtle, but it is important. It is very, very important. Then simple techniques like ventilation, mindfulness, meditation can be used on the spot, by the way. This clinical psychologist will tell you, isn't it, ma'am? It can be used. And we have been using those even through telemanas, even through the telephones that we have been doing, and people have been responding well. So I tell you practically that yes, it works. It really works. Please assess suicide risks. Please ensure that there is no further harm, because further harm can be, or even you, if you try to overdo things, you may actually harm. So that is something which is very important, and encourage them to help themselves. Okay? Next, please. Of course, now we go on for about the information. So situation is important, and everything that you say should be based on facts and truth, not just nizana mumanga kamua or kangai danchuan. Like it should be based on facts, because we in Mizoram we usually say katenum papon so what fact is that, man? I mean, I don't know, ma'am, you understand what I'm saying? No, they may say that my neighbor also ate this and he was fine, so please eat this. They're just prescribing. You may have an anaphylactic reaction, something bad may happen to you, so we have to be careful. So it should be based on facts, and it should be based on the truth, not just what you think. And then, of course, you should have enough information about NGOs and the government. Like we in the government, I'm from NMHP, that is National Mental Health Program, which also caters to the DMHPs in the districts, District Mental Health Program. And now we are also looking after the digital wing, which is the telemanas. We call it telemanas. We will talk about that. And of course, we tell them to approach family and friends and people who they think are important in the society, not who you think is important. So kan pastor peak a fellow panro. The eyes one tunge. That is important. Okay? So what they feel important is important. What you feel important is secondary. I'm not saying it is not important. Just saying it is secondary. Yes, please, sir. And then, of course, this number, 14416, I want each and everyone to please write down, if possible, either in your mobiles, yes, or in your books, or in your minds. This is all over India, pan-India, 14416. But since we are here in the northeast zone, when you dial, this is toll-free, when you dial 14416, a voice will tell you, for English, choose your language of preference. For English, dial 1. Hindi ke liye 2 dabaye. And like that, they'll keep on saying. So you, for Mizo Tan Panga Metro, po andro tithau. But it takes too much time, so I usually press 1 because I understand English. Write 1, ma'am, 14416, 1. And then it'll tell you, dial 1 for Arunachal Pradesh, dial 2 for Meghalaya, dial 3 for, I think, Manipur or something like that, and dial 4 for Mizoram. So that's why we have written 14416, 1 and 4. Now you can dial this any time of the day. Any time of the day. But since we have at present 4 lines, in the daytime we can take 4 calls at a time. But at night we have only 2 people doing the night duty, so we have 2 people. At a time, 2 people can talk. So if you remember this, if you can share it with your friends and tell them anybody who requires psychological first aid, and after you have talked, if they still require, they may dial this number. And I assure you that those people who are on the other side of the line are counselors. They have been trained by NIMHANS and also by Mizoram. And we also have clinical psychologists, psychiatric social worker, and psychiatric nurses also there. We have these 3. We haven't got a psychiatrist because there is no psychiatrist who is available for this at present. By the end of the year, we are hoping we'll have one. So the DMHPs are there, the psychiatric department is there, and of course in other settings also, like we already discussed with the lady here, even the pastors and the elders, church elders are welcome. So they can answer to all those calls. And of course, if there are any other settings like the settings that you have here, I'm told, Madam told me that you have got a very good setting here. You have people who answer for counseling, and I'm so glad that you have people like that. And they are good enough, you can trust them. They will answer and help you. I'm not saying they'll solve the problem for you because they cannot solve it, they are not gods, but they can help you. Next, please. This is something which you need to remember, the things written in red. Very important. It addresses, psychological first aid, addresses immediate problems and basic needs. That's why we are not saying that a YMA guy can solve everything for you. Even a psychiatrist cannot solve everything for you. So these are the things when we talk of psychological first aid. Just remember this. We're not targeting very, very big things. These are the small but very important things which we target at the psychological first aid level. Next, please, sir. And of course, what it is not is also important. What it is important, but what it is not is also important. If you look at this, what is it not? It is not offering psychological debriefing. It is not asking about the details of the traumatic experiences. It is not talking about the treatment. We're not dealing with SSRIs and NARIs and antipsychotics and all that. Nothing to do with that here. We are not trying to come to a diagnosis, ICD or DSM or whatever. It is not something only professionals can do. I think we have made this very clear. And it is not about providing on-site therapy. Please mind this. It is only about immediate concerns. Because it is the first aid. So this is something which is very important. We have to pass this now? You want me to pass it around? Okay. Next, please. It's about to be over, so yes, it is over. So if anybody wants to put anything here, I mean, it looks so bad. No? It's only 2 papers are here. Write something. Write some questions. Try to ask something which I will not be able to answer. It's so ask me something hard. So I'll give you 2 minutes to write, and after 2 minutes I will stand up again, and if you don't ask, I will ask you. No, it's simple. Either you ask me or I ask you. So it's up to you. And the good professor has already told you, Ziakrawati, come on. Ziakraw in English means write. Please write. Yes, sir.
Hello. Sir, I don't want to write it because I don't find myself too shy to write. So I wanted to stand up and ask you. What my question is? My question may be beyond the topic, but what I want to ask is that as we let me say as as a student, or like, I don't want to say it, but as an educated person, let's say I'm not that educated, but yes, but what can we do? Suppose we are not, as you said, not all can perform that psychological first aid, right? In the first. Okay.
Everybody should do first psychological first aid.
Oh, can you go to the first slide, please? Again, please. Yes. That then. Yes, and on that other first responder, you mentioned about the YMA, right? Yes, the YMA and certain organization maybe. Okay, my question is, let's cut that question, okay? So as we, the student, or my question was an educated person, what can we do to others, those who needed us? Because I had an experience. One of my friend is an alcoholic. Let's just say, let's just not mention who he or she is. Okay, whoever the name is. So I tried my level best to encourage him, but I failed. As a friend, I failed, and now he is at home. So I feel very bad about that. As a failure, I want to ask you, what can we or I do for further action?
First of all, sir, you did not fail. Whatever the other person wants to do is not because of you. You did not fail, sir. You tried your best. And for that situation, I think it's very much appreciated that you did what you did. It could have been much worse. Who knows? So first of all, you do not blame yourself. Okay? Don't blame yourself. You were never a failure to start from the beginning. I'm glad you asked this. But that was what I was talking all along, what you can do. But okay, we'll repeat it. When it comes to substance use, it is very much the person's own choice. Everybody has a choice when you get up in the morning, whether you want to smoke, you want to drink alcohol, you want to inject yourself with all sort of drugs. So that choice belongs to your friend. It was never yours. Sometimes patients come to me and say, "Pathian in remati ichuan kasim veang." So it means pathian in remati lauti nami. No, see, you can't blame God, na. Pathian remati lo vain kasim lo. No, don't blame God. That's why I keep telling them, it's your choice. God has given you a choice. He has also showed you the way. He has given me the responsibility also to show you the way. I can show you the way, but I cannot walk for you. I cannot do that for you. You have to do it yourself. So, I think you did the right thing. I think you tried to motivate him to give up. Isn't it, sir? You did that? In psychological first aid, like we said, we do only two things. Immediate concerns. If that substance you said he's an alcoholic, if that substance because of which either he was having withdrawal or intoxication, two things happen. When they keep drinking and they suddenly stop or drink less, withdrawal happens. They get shakery, jittery. They may even have seizures. I hope you mentioned those things to him. I hope you took care of that immediate needs. Hana? If you did that, in psychological first aid, we don't expect anything more than that. But to give up or not to give up was never in your hands. It's not in my hands either. God also has given the power to us, whether we want to do it or not. It is up to your friend, not to me or to you. So I think you did well. Encourage him. Don't stop there. Don't think it's a failure. Encourage him to give up. Tell him the pros and cons, why it is better to live without drugs, and why it is bad to carry on drugs. If you do that, sir, you have done more than what you had to do. I hope it answers your question, sir. Yes, sir. Anyone else? Yes, sir. Sir, आपका mic on है?
Sir, as a common man, how to identify that opposite person is in need of first aid. How to identify that opposite person is having stress or anxiety. So what are the symptoms or what are the signs that we can identify?
Indeed, a very good question, sir. This morning, sir, did Madam tell you something about what anxiety was? What symptoms were there? Acha, you are. Okay, can you please, ma'am, can you read it?
So in these slides we have how can I help and how do I know I have anxiety or symptoms. That's one. Restlessness, nervousness.
Everyone has this? Does everyone have it?
Yes. Palpitations, increased breathing and heart rate, feeling lethargic, numbness or tingling sensations.
We will take one by one. First one is?
Restlessness.
Sir, is it clear, restlessness? Or should I explain restlessness? Next point. Sir, we are coming to that.
Nervousness.
Nervousness, sir, I don't have to explain. Next.
Palpitations.
Palpitations, you understand? It's a subjective feeling that your heart is beating so fast. Tuk, 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 something like that. And when you feel that, no? That is called palpitation. Subjective feeling. I mean, other people around you may not feel, but you feel yourself. When you're scared.
Feeling lethargic.
Feeling, sir, that is very clear, sir. Feeling weak, very weak, tired, lethargic. Less energy, no energy.
Numbness or tingling sensations.
Numbness means when you touch, sensation is less. You don't know that you've been touching or something is touching you. That numbness is there. It means that the sensitivity of the touch is less. Next.
Shortness of breath.
Shortness of breath means you are not able to, when you feel that you cannot breathe up to your lungs capacity. I could feel that. I can't breathe more than what little bit. So shortness of breath. You cannot fully breathe. That thing, that feeling. Next.
Dizziness.
Dizziness means lightheadedness, means little bit chakkar aane. That. So sir, when you have all this, these are signs, these are symptoms of anxiety. That's how you recognize anxiety. There's a difference between signs and symptoms. P. Mingi will tell us what is signs and symptoms.
Signs would be, symptoms would be something subjective, something that the individual feels by themselves. Signs would be more objective in nature, something that other people can observe from the outside.
Okay, let me elaborate that. When a patient comes to you and says, I have fever, that is a symptom. When they come and say, I'm tired, and when you put your hand on their forehead or use thermometer and say, you have fever, that becomes a sign. Meaning to say, when the patient says it, it's a symptom. When the caretaker finds out, it's a sign. As simple as that. Basically, it's all the same. Fever could be both sign and symptom. You understand, sir? So all these things could be signs and symptoms also, because he may not come and tell you that I have palpitation. He may not even know that word. But he may say, I feel my heart beating very fast. So when they say that, you can write feeling of palpitation or just palpitation. So these are signs of anxiety. Similarly, sir, when a person is, say, feeling sad, there is loss of, say, interest. He used to play football. He has no interest now. Loss of interest. He feels very sad. Okay? And this happens for at least, say, 2 weeks. Then we diagnose them as a person having, and other symptoms, we'll talk about that also, as having depression. Now the same thing, a child will not come and say, I'm feeling sad. 5-year-old, 7-year-old, what will the complaints be, sir? Any idea? Yes, irritability. Hello, beta. Something like that, isn't it? Irritable. Little bit. No, that feeling. No, I'm telling you this why. Because the child will not understand what is that they are irritable. You as an adult have to identify that. Then you'll ask the mother maybe, does he not play anymore? Does he go out? the mother will tell you, he used to feel like playing all the time, now he's staying indoors. Then it means loss of interest is there. He used to eat a lot of food, now he's not eating food. Or he used to eat less food, now he's eating a lot of food. Increase also can also be there. Or he may sleep too less, or he may sleep too much. So all these are some things which we find that which is not normal in the person's normal, extension of life over the period of time. Then you can say, those are the signs. I hope it answers your question, sir. Because I cannot tell you each and everything. 3 years, it took me, sir, 3 years to do MD. I cannot tell you in 5 minutes all those 3 years, It takes time. Yes, sir.
I'm sleeping, and immediately after getting up, so I have some dizziness. So after getting up from the bed, or in a sleeping mode to standing mode, immediately some blood flow loss is there. I'm feeling like that. I'm having some dizziness type. Immediately. So after a while, if I settle down or I sit down for a while, so I'll be okay. And again, I'm able to walk and again. So what is that? Is it an anxiety or some blood loss? Or something?
I hope each and everyone understood the question. Sir says, when he sleeps and suddenly gets up, then he feels dizzy. Even from sitting position, if he suddenly gets up, he feels dizzy. After some time when he walks, it's okay. When you sleep. That is, sir, orthostatic hypotension. That is physical problem. Meaning to say, we also call it position hypotension. From a sleeping position, when you sleep, your head, your heart, and your feet are all in one horizontal plane. When you get up, your feet goes down, your heart is in the middle, your head goes up. Some people have a problem that the blood does not get pumped up to the brain. So you have slight dizziness. When you are fit and strong, usually it doesn't happen. But if you're slightly weak, or say if you have some other problems, it could happen. So for that, we either tell them, okay, don't get up suddenly. From a sleeping position, don't just stand up. First sit properly, sit for some time, take your time, then you stand up. You are giving the heart some time to pump the blood to the brain. Hypoxia. There's a condition called hypoxia. Hypo means less, oxia means oxygen in the brain. So that is not anxiety, sir. But if that continuously happens, it could cause a concern. Then it may make you feel anxious. I may feel that again. Sir, exercise kariye, sir. Yeah, sir, exercise kariye. Do some exercises. Physically, you should be fit. Nowadays, sir, I know it's very hot. We are encouraging people to drink a lot of water, a lot of fluids. Please, if possible, go and check your LFT, liver function test, kidney function test, even lipid profile. Even lipid profile means to say there's cholesterol, fats in the body. Some good fats are there and some bad fats are there. So HDL is good, all the others are bad. So they should not be high. And if it is okay, then you won't have this.
Kansung komembar zingami pakat hi zana amut thei lo mai ni lovin amut thangai lova chuanin choi tamngai lova chuan hi na hi thore ngai sia chuanin anxiety kan ai niang te potia ke mani ponia ti dan dan kan zong ke mani pon tran pui kan tum thina chuanin enge kaya te zana te aron khurle thut chela mat tiri la hi chumi chu thi lonang hian in tianom le thina engtin nge tiang an niang o kala atia nge kha ama nervous system lampang chaklo wang ni ten kan sheta wangin tuna po damdoina kan kalpui na satwa amaro chu nerve lampanga na tuna hian Mizoram an tama wangin zing da thumate nge kan pan te khangai thina chumi chu engtianga hanti tur nge kan hretchi alova hemi hi kema tan chuan stage pai mo lutuk han zona rem chang ani wangin karon zot chea chuanin
pakhat le chu ka thianu hi nia ange tet lai hianin an open lai min share tawa ke ma deuh chei min le share chumi chu an open lai hianin anu nen che hianin a pat kha ange kha anin thren na wang khanin anu nen che khan anom chho kha hemi passion ani chu chumi chu anei chawa khata a passion zinga a thian pa unau pa nen khan khatiang khan kum no pangte ni nan lo che suala chumi chu trauma anei ni na ma po khan a soya ge ma pan ka oi puya khami khati khanin hun thim takha ma chon chho ve a ti chuanin miron betrina trap chela ka mi khan nem dan ka thiam chi alova I the patopin I the me mang I neang ka tia ka fui chho chela chumi chu engting e han ma an lak le dan yang ma han lak le dan tur ti ve kha I a thei chuanin min chan sak thei chuan ka lo ngota
Tekan ti zona ka kan zot chiang le lok che ong mut ahar sata a khu thin thero anxiety ane itia nei ai angin ain ria a swan a nervous system at halawit ya thero a nervous system at halawit so engtin ngi han soifia lok them ding lami khoya veilama ni chong lawa only right side tina khoi chu in soifia them engtin nge me pa ngai ani lo mi tina mi ka ra thiam me ani le zona pakhat chel thu chung min chang me ro rui lo tiam oi even soitha katina chan chu rui lo kan ti hian tilo an tia mezial ti chan chu ti tia mezial an chiar nga rui lo an chiar lawa iron chiara tha mezial tobacco re rang hi WHO chuan rui lo wa apom ti kha ipom kha wangin a lo mom phot me ya zu chu ti lo ti na ati ngai to mi lo mai nilawin ati ngai lo shim ale acha amu thelo na chan chu enge niang stress anga tina nge a anna lama nge relationship problem nge kha ria tanga ya so tak chu nia si thil re reng hi mo you have to catch it from the base kha khania tu na kha chun soi kha arem vek don lawai tan po a nom poi ti lo mai thea khang tiang ta kha contact ka langai mo ama na comfortable china khana ran soi chu anga ya kha kan pui don ani chuan kan pui adu don ani chuan khang tiang kha ran phor ngam se chuan kha pakhate ten kan en puyang chuan kha ta tang khan ma kan son the asan chu tu na damdoi ringot zia kha chu har lo mutna chu tam mai kan ziak nga ma se chu chuan tu na chau apui don long term apui don lo long term tur kha chuan a e char si kha chuan a edict palang te hlong box ya chu wang chuan tu na stress iti kha kan di langai in van ne ya katia psychology department in ne ya clinical psychology department po in ne ya refer ro alo pui theng che so ta chuan chan chu engkim kha phor chu akhar iti don sia chu pakhat na chuan ethian pakhat kha po khania katha thiam lawa PTSD kan ti ta mo post traumatic stress disorder chu ani mela ma se chu mi tur chuan kan confirm angai phota kan zo angaya kha ni nge aman shame and guilt ane nge athin rim anger mo enge what is the issue real issue kha kan zo nangai ta ne chuan khang tia to pon khamitan po khan dam doi chu om thowa le clinical psychologist in ne ya an pui theng cheu chumi chung pon aladam lo ni choran hey psychiatry ward te pokan ya OPD pokan ya run tir ula khang teng chu tam takan lo kalan dam adam thai it is curable kati treatable chok pani lo is curable so wang chuan encourage lamo nangma level a chuan ahar mai thei achan chu ma lai thilania tun thleng kha ala theng hil thei si lo chuan so wang chuan kha refer kha apoimo refer thei pokha thil tha thak eti don ti na ni chu oh thank you so much zona hi om nuala we will request our sir to read out the questions and we will see how much should we take it all sir or should we answer atelu to some of them are written so small I can't even read them kan pel tong mo I'll read out okay okay no issues or if you want if there's paucity of time you give me this I will take it and give you answer in written
Okay, that will be fine.
if it's okay with you ma'am
We have a group with them. So,
yes
we have a group with them, so we can circulate it in the WhatsApp group.
no issue sir
Okay. So I think you can.
I'll have to take this but actually you want big okay as requested by sir I'm here to give you my concluding remarks the remark is very simple anyone can take up psychological first aid remember this in psychological first aid what we aim is the immediate problems okay and if you cannot do it immediately please don't think you are a failure by referring there's so many patients which I refer to other doctors as well because I know this may not be my domain because I'm not a surgeon if the person comes to me for surgery I refer for surgery it doesn't mean I'm a failure okay everybody has got their own expertise so it's not your area so just remember to tackle and deal with the immediate problems and then you may refer okay thank you so very much for being so patient thank you
I want to thank our afternoon speaker, Dr. Robert, for a very lively and entertaining session. The program after lunch is always something which we do not look up to because after we have a very heavy lunch, most of us feel sleepy. And especially me, I usually fall asleep in the afternoon. But the program was so interesting that even I was quite wide awake. So the lecture itself was not only psychological but physical first aid for us. And I think we're going to conclude now. Before I invite our Professor Lalropuii and Asilo for the vote of thanks, I just want to remind you again that you, not only us, but you who have come and attended this session today are responsible for your fellow students. So after learning from forenoon and afternoon, you are now what Sir have said that you are all first responders. So you can help your classmates, your friends, and like Sir have said, if you cannot help them from your personal capacity, MZU Counseling Cell is there, phone numbers are given, so in that you can refer to that. And especially right now, in the near future, examination is coming up. So I think that anxiety level will be shooting up soon. So I think we'll have a lots of tasks at hand. So I hope that you'll be able to utilize your training today to help your friends for psychological first aid. Thank you. Then let me invite I'll invite Dr. Sandhya to give a certificate and our token of appreciation to our speaker this afternoon. Dr. Robert, please. After vote of thanks. Now I'll invite our DSW, Professor Lalropuii and Asilo, to propose the vote of thanks, and after which
will not exit from this building and we'll take a group photo.
Thank you, sir. So now we have come to the end of our afternoon session. And proposing vote of thanks is a very difficult task because it's very easy to forget the contribution of somebody. But as I've been tasked by the head of the counseling cell, I'll do my job as a good boy. So firstly, I would like to thank profoundly our Vice Chancellor, Professor Rath, who came and graced the inaugural function of this workshop today. Despite his busy schedule, he could make it. And secondly, I would like to take a moment to thank our experts today. In the morning, we have Dr. Lalropuii, who is the director of Black Olives Counselling and Research Centre, Khawlhring. And then also we have, in the afternoon, we have Dr. Robert L. Khawlhring, who is the psychiatrist, Govt of Mizoram. And it's a very important interventions that they have provided to us. And through their lectures, now I think all of us are enabled to become first responder whenever our near and dear ones and friends are needing help psychologically and then also to a certain extent physically. So we are so very, very grateful to you, sir, and Dr. Lalropuii as well. And thirdly, I would like to thank our students' representative here from various departments and our teacher coordinators for coming here, responding the call of the Counseling Center, because as highlighted at the inaugural function, this is a very crucial intervention for Mizoram University, because when the enrollment is increasing, we are bound to have more cases of psychological illness and problems. So for that, we are now taking the first step in equipping our students and our faculty coordinators. So once again, I would like to thank our students, participants, representatives, and our teacher coordinator. Last but not the least, I would like to thank all the members of the Counseling Cell, Mizoram University, especially the head of psychology department, Professor Zoengpari. Under her able leadership, this counseling cell is moving on in a very, very positive directions. And so I am very, very impressed, and I do appreciate her initiative. And so in the same wavelength, the response that comes from all the members of the counseling cell is also quite commendable. So without further ado, I'll end my Thanksgiving. And so for all of us who are here till the end, I thank myself and all of us. Thank you.